Understanding Cervical Cancer Screening, a UCSF educational screening tool. You have the option of choosing the English module, Let's Talk About Pap Smears, or the Spanish module, Hablemos acerca del Papa Nicolau. Confidential. Why are you here? Click on the reason you're here. I'm here for a checkup, or I'm here because I had an abnormal pap smear.
Let's talk about cervical cancer screening. You've probably heard pap smears are important for your health, but you might not know what they actually are. You're not alone. A pap smear, or cervical cancer screening test, looks for changes on the cervix that may, in very rare cases, lead to cancer. Finding these changes early means getting the care you need to make sure they don't become a problem. Most cases of cervical cancer are associated with certain types of the human papillomavirus, HPV. Read on for more about HPV, including how HPV tests are used as part of your checkup.
What exactly is a cervix? The cervix is part of the female reproductive system. Find all the parts of the female reproductive system. Uterus, where a baby grows. Fallopian tubes. Ovaries. Vagina. Cervix. The cervix is at the lower end of the uterus where babies grow. It's about 1 inch wide. The cervix connects the uterus to the vagina. What does a normal cervix look like? If you want to see a drawing of a cervix, click on the first tab. If you want to see a photo of a cervix, click on the second tab. Or you can skip. What happens to the cells collected during a pap smear? What happens to What happens when you get a pap smear? When you go into the healthcare provider's office for a pap smear, first you'll get undressed and change into a gown. The healthcare provider will ask you to put your feet in the footrests. The healthcare provider will put a speculum in your vagina. The speculum keeps your vagina open so your cervix can be seen. A spatula and brush are used to swab cells from your cervix for testing. The pap smear should only take a few minutes. You might feel some pressure or cramping, but it shouldn't be painful. If it is, speak up. What happens to the cells collected during a pap smear? The cells are sent to a laboratory where they're looked at under a microscope. If there are no changes in the cells, your provider will tell you that your pap smear is normal. If your pap smear is abnormal, don't panic. It's common and does not mean you have cancer. It just means that there are changes in the cells that need to be looked at more closely. It usually takes 1 to 2 weeks before your results are ready. Leave your contact information so the office can reach you. What exactly are the changes that might be seen on a pap smear? Pap smears look for whether your cells have changed in size, shape, or how quickly they are growing. The changes can be caused by human papillomavirus, or HPV. What causes an abnormal pap smear? HPV. What is HPV? HPV stands for human papillomavirus. HPV is a very common sexually transmitted infection, or STI. In rare cases, this virus can lead to cervical cancer. HPV is different from HIV, which stands for human immunodeficiency virus. This is a drawing of what the virus looks like close up under a microscope. How common is HPV? HPV is so common, about 80 out of 100 women will get HPV in their lifetime. Usually, a woman's immune system can fight off HPV, just like the flu. In rare cases, women do not fight off HPV, but in most cases, this does not cause symptoms or problems. In most women, HPV will go away on their own. What's my risk? Only about 1 in 10,000 women in the United States with HPV will get cervical cancer. And if cancer develops, it usually takes a long time, 10 to 30 years. 10 to 30 years is a long time.
Does cervical cancer screening save lives? It sure does. Most women who get cervical cancer have never had a pap smear. Pap smears let us find cells with ongoing changes called precancers so that women can get the care they need. HPV tests let us detect HPV types that increase the risk of having a precancer. Your provider may offer you a pap smear, HPV test, or both.
When should you start having pap smears? You may have heard that you should get a pap smear when you start having sex. Leading doctors and experts looked at new data and decided that women should start getting pap smears at 21. Do I need to have a pap smear before 21 if I'm having sex? No. If I have more than one sexual partner? No. If I'm pregnant? No. If I have had sexually transmitted infections? No. I am 21 or older? Yes. Why 21? HPV is very common in women under 21, but almost all infections in young women and the changes in the pap smear will go away on their own. Waiting until you're 21 protects your health by making sure you don't get more tests and treatments than you need. Cervical cancer is very, very rare if you are under 21, so it doesn't make sense to have a pap smear. How often should I have a pap smear? After 21. After you turn 21, you should get a pap smear every 3 years. This is enough to find HPV infections that aren't going away on their own, but not so often that you might get treatments you don't need.
Age 25 and over. After you turn 25, you have options. Pap smears every 3 years, or HPV test that looks for the HPV virus and a pap smear every 5 years. This option is for those over age 30. HPV test only every 5 years. The pap smear is done only if the HPV test is positive. After 65. After 65, most women can stop having pap smears. This is normally recommended for women who have a cervical health history that shows regular screening and no abnormal tests.
Is it bad to have too many pap smears? Having pap smears too often can lead to unnecessary treatment. Just like a cold or flu clears up without treatment, abnormal cells and HPV can go away too. While treatments are important in certain cases, they can cause side effects. Select each one. Heavy vaginal bleeding, which may require emergency care. Early delivery in the future, which can cause lifelong problems for the baby. Infection. Are these screening recommendations safe for everyone? Women may need screening more often, from being HIV positive or from having an organ transplant. Why did they change the guidelines to give pap smears less often? To save money? No. To make more money for doctors? No. To protect your health? Yes.
What else can I do to help protect myself and others? Select each one. Get vaccinated. All males and females under age 27. Ask your provider if you're age 27 to 45.
Protect yourself. Use condoms. Stop smoking. Smoking increases your chance of getting cervical cancer. Get tested for sexually transmitted infections.
Make sure kids and grandkids ages 9 to 26 are up to date on their vaccines. In addition to protecting against cervical, vulvar, vaginal, and anal cancers, research shows the HPV vaccine can also prevent a number of penile and head and neck cancers. Is the vaccine safe? Yes. Millions of doses have been given worldwide, and it's shown to be very safe. The most common issue is pain and swelling at the site where the shot is given, similar to many other adolescent vaccines.
Nervous about talking to your healthcare provider? It's okay to ask questions. Here are a few to get you started. Do I need a pap smear today? When do I need my next pap smear? When can I expect to hear about my results? Should I get the HPV vaccine? Are there any risks?
Takeaways. So what key points should I take away? HPV infections are common, and most go away on their own. Women should start getting pap smears at age 21. HPV vaccines. Age 26 and under, get vaccinated. Age 27 to 45, talk to your provider. Getting a pap smear every 3 years or an HPV test every 5 years strikes the right balance between protecting you from cancer and avoiding too many tests. Want more information? Talk to your healthcare provider about what options are best for you. Feel free to learn more about abnormal pap smears or check out some online resources. Thank you. Take a quiz on cervical cancer prevention. Click here. Return to the beginning.